Hello and welcome to Reason News. Today we bring you an important update on the ongoing efforts to combat HIV in South Africa. We'll be focusing on recent developments concerning funding for crucial programs, with insights from a key figure in the nation's health sector, Dr. Motsoaledi. South Africa has been at the forefront of the global battle against HIV. Significant strides have been made in prevention, treatment and care, transforming the lives of millions. However, sustaining these gains requires consistent and robust financial support. Today, we're delving into the current landscape of HIV funding in the country and examine the perspectives of a leading voice on this critical issue. South Africa carries a significant burden of the HIV epidemic. At its peak, the virus had a devastating impact on communities across the nation. Through dedicated efforts by government, civil society organizations, international partners and healthcare professionals, substantial progress has been achieved. Antiretroviral therapy, ART, has become widely accessible, dramatically reducing mortality rates and improving the quality of life for people living with HIV. Prevention programs, including awareness campaigns and access to testing, have also played a crucial role in curbing new infections. A key figure in South Africa's response to the HIV epidemic has been Dr. Motsoaledi. Throughout his tenure as Minister of Health and in his current roles, Dr. Motsoaledi has been a vocal advocate for sustained funding and effective strategies to combat the virus. His insights into the financial mechanisms and challenges associated with HIV programs are invaluable in understanding the current situation. The funding landscape for HIV in South Africa is multifaceted. It involves significant contributions from the national government, supplemented by support from international donors and organizations. However, shifts in global health priorities and economic pressures can impact the availability and allocation of these funds. Understanding the current state of this funding is crucial for ensuring the continued success of HIV programs and the well-being of those who rely on them. We now turn our attention to the latest updates and perspectives on this vital aspect of the national health agenda. Here's a video from the SABC.
We are spending 46.8 billion rands on the HIV/AIDS and TB program this year in South Africa. PEPFAR is contributing 7.9 billion rand of that. So when that money gets withdrawn, it will be 7.9 billion rand. PEPFAR was helping us in 27 districts out of the 52 districts of the country, 27 districts in 9 provinces, because Northern Cape is not part of this. It's not part of the PEPFAR funding. So the number of people in these 27 districts who are working on HIV/AIDS are 271,606. Out of that number, 15,000 are funded by PEPFAR. And it so happened that these are the people of interest. But 8,000 of those, their jobs have come to an immediate end with the announcement because they were paid by PEPFAR through USAID. Yeah. The others who are paid by PEPFAR through CDC, Center for Disease Control in America, they still have a reprieve until at least September. So this is where we are. But when it comes to ARVs, the antiretrovirals, for the 5.7 million people who are on antiretrovirals, when it comes to that, we pay for 90% of that from our fiscus. PEPFAR has not been buying ARV for us. We buy them for ourselves. And then 10%, we buy it up to 90%, then 10% is bought for us by the Global Fund. Now, this is where we are at the present moment.
Dr. Motsoaledi's insights highlight the ongoing complexities of funding the national HIV response. Maintaining the progress achieved requires a sustained commitment from all stakeholders. Any shifts or challenges in funding necessitate careful consideration to ensure that the gains are made, not reversed. and that individuals living with HIV continue to receive the care and support they need. The discussion underscores the importance of transparent and accountable financial management within the health sector. The fight against HIV in South Africa is a marathon, not a sprint. While significant victories have been celebrated, continued vigilance and adequate funding remain crucial to achieving long-term success. The perspectives shared by Dr. Motsoaledi offer valuable insights into the current financial landscape and the path forward. We will continue to follow developments in this critical area, but thank you for joining us on Reason News. Until next time, stay informed, stay updated, and stay curious.